Let's take things a step further. Somebody gets to the point with a tooth where it's causing a lot of pain. It's determined that a filling's not even going to rectify it. So they either have to pull the tooth out or have a root canal, which is such a controversial term within this oral care world. How do you feel about root canals, and how do you look at that situation?
I feel that nothing in the world is black and white. Okay. So I don't like saying root canals are perfectly safe. And I don't like saying all root canals are terrible and going to give you cancer. It's definitely somewhere in the middle. The issue isn't the root canal. It's not the procedure. It's how the procedure was done, and was it done appropriately and with the best materials. So I do believe that you can have a more integrative biological root canal performed, but there just aren't many people doing it. And so that involves microscopes and lasers, and ozone therapy and biomimetic materials. I think every root canal is temporary. It won't last you your whole life. They need to be checked and examined frequently, and not just with two-dimensional x-rays, which is what we're used to, but a 3D cone beam, because a lot can get missed on a two-dimensional x-ray. So you want your root canals checked every 3 to 5 years. So I'd like to say, like, do you already have root canals? Deep breath. Please don't panic. Please scroll through people ranting and raving that it's going to kill you and this, that, and the other. Because again, how was it done? Who did it? What was the situation? Maybe is there bacteria left deep in some of the tubules and crevices and fungus? Sure. But your body might do an okay job at kind of walling that off and protecting it. Like how are you feeling? Are you thriving and systemically wonderful, or are you sick? And if you're sick, maybe we should look at your root canals. But I don't love the idea of everyone rushing out to have them extracted and removed and implants placed, because implants have issues too. Implants fail. Not everyone can tolerate the zirconia or the metals that are used in implants. Some of us react to those too. Some argue it's just not great to have anything implanted in the body if we want to get into like energetics. So I will tell you, there's a lot of people making a lot of money off from extracting root canals and doing cavitation treatments and implants. I'm not trying to be cynical, but just be cautious. So if you need a root canal right now, that is where I'd say maybe that's a skip it. If you need one, a back tooth, you're not emotionally attached to that tooth, maybe you do consider getting it removed and an implant. That is what I would do. Now, I have 2 root canals here on my bottom teeth from a facial trauma when I was 10. I have had them retreated once by an integrative endodontist in LA. It was many years ago, and now they're starting to fail, and I just know they need to be removed. Okay, so now is the time. They've had a good run. It's time to go. So I am going to have them extracted. But they lasted a long time. They lasted 3.5 decades for me. So I think if it's a front tooth, there's an emotional component to that. It's really easy for a surgeon to say, oh, you need that out, but it's your front tooth. Like, how do you feel about that? Maybe we want to keep it a little bit longer. And so I think working with someone that has a calmer, more nuanced take on some of these things and not quite so sensational would be my advice. There's people saying that root canals lead to breast cancer. I haven't seen any truly compelling evidence to make me want to yell that from the rooftops either. Is it possible? Yeah, sure. Anytime we leave something of imbalance or dysbiosis in the body. But again, that's not everyone's root canal is going to be infected, and that's why I just think having them checked. So if you have root canals, my best advice to you right now is just ask someone to do a CBCT scan on them and to see what they're looking like. And if there is acute infection or chronic infection rather, at the apex or at the root, you may want to talk about having them removed. If they look fine and they're holding up okay, Cool. Another thing you can do is find a dentist that does ozone injections and have them every few months do little ozone injections around your root canal, because that ozone's going to go in there. It's antimicrobial and it will just kind of keep things at bay for a while. And I do that on myself too. I actually inject myself.
And in your case, having those removed, what will your options be at that point?
Great question. I wanted implants, but there's so little bone there. This is another thing with front teeth. Front teeth implants can be very hard to place and then make them actually look aesthetic after. So I might do what's called a Maryland bridge. It's a bridge that preserves the health of the adjacent teeth. I think that will be my best bet. So it's a very conservative bridge, essentially, that will be down there. And trust me, I don't want to be doing this, but I feel like I'm personally in tune with my body a bit, and they're just feeling twingy. That's not scientific. I understand that, but I just know it's time for them to go. I've kind of thrown everything at it, and now it's time. It's time to say goodbye to them. So
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.